I'm Sunil Iyengar, and I'm the Director of Research and Analysis at the National Endowment for the Arts in Washington, D.C. In a moment, I'll be introducing my colleague, Bill O'Brien, but I wanted to say that we're both honored to be here with you, thanks to LA Opera Connects, as part of the 2025 LA County Arts and Health Week. You probably know that the NEA is an independent federal agency and the largest funder of the arts and arts education in communities nationwide, and that we're a catalyst of public and private support for the arts. But you may not know that the NEA is a proud supporter of the arts and health, inclusive of, but not limited to, creative arts therapies. In particular, as director of the research office at the NEA, I can share that we've supported many different types of studies over the years about the arts' relationship to health and human development across the lifespan, from reports about the arts' benefits for social and emotional learning among children and youth, to studies of the arts' positive role in improving well-being and functionality among older adults. We've looked at arts programs and interventions to address the opioids epidemic, and we've issued a guide for researchers and practitioners who collaborate on community-based studies of the arts and health. We also have invested in research grants to support neuroscientific studies of music, drama therapy, and the healing power of the visual arts. Now, I know that mental health and social and emotional learning are among topics that are being addressed by the summit. So I urge you to go to our website, arts.gov/impact/research, to see some of our publications and other offerings on these and other topics. Again, that's arts.gov/impact/research. In particular, I want to call out a report we released earlier this year titled Snapshots of Arts Education in Childhood and Adolescence, Access and Outcomes, which talks about the positive outcomes associated with arts education, including social and emotional skills development. Finally, I want to draw your attention to our annual research funding opportunities. We have two of them, the Research Grants in the Arts Opportunity and the NEA Research Labs Awards. Both award mechanisms have been used to support a variety of studies and data sharing about the arts, health, and well-being. With that, I'm going to introduce my dear colleague, Bill O'Brien, Senior Advisor for Innovation at the agency and Director of Creative Forces, NEA Healing Arts Network. Bill?
Thank you, Sunil. My name is Bill O'Brien. I'm the Senior Advisor for Innovation and the Director of Creative Forces for the National Endowment for the Arts. I'm here today to talk a little bit about our national initiative, Creative Forces, the NEA Military Healing Arts Network. Creative Forces is a partnership of the Departments of Defense and Veterans Affairs. It places creative arts therapists at the core of patient-centered care in DoD health facilities as well as VA hospitals, and also includes community engagement in community settings. We'll begin today by hearing from some of our military patients who've come through our program.
I was a combat company commander. When I came home, I had so many anger issues. Then it turned into depression, it turned into hurt, shame.
The most difficult thing I ever had to say, there's three words we're all terrified to say, is I need help.
Art and art therapy are probably one of the only things that I've had in my life that I would equate to post-traumatic growth. It's how you're gonna grow, how you're gonna change.
I was able to heal by utilizing music, was able to heal by utilizing the arts. I was able to see it, feel it, and I knew it made me better.
Even though I have PTSD and trauma, it's gonna be okay. You're gonna go through some things, but you're not by yourself.
Creative Forces began as a partnership with Walter Reed in response to the signature wounds of our recent wars. These include traumatic brain injury and associated psychological health issues, including PTSD. There has been, as many people are aware, a real issue with PTSD and TBI in the military. There's been close to 500,000 people who have been diagnosed with PTSD as active duty service members since 2000. 11 to 20% in any given year have been diagnosed with PTSD. We often think about how military medical innovation can translate into broader societal impact. And there is certainly a growing need for us to understand how we can more effectively respond to these issues across a broader society. There are 2.8 million Americans who reported TBI incidents per year and 15 million who are dealing with issues related to PTSD. We began as a clinical program at the National Intrepid Center of Excellence at Walter Reed, and the integrative care model that they were pulling together at this point in 2011 included lots of different modalities of treatment. And in our conversations, we were collaborating on how we could investigate putting creative arts therapies at the core of these alongside various other interventions. These are mandatory. They are required for people coming through the program. They're not extracurricular activities that people choose to participate in. They are part of a 4-week program or 6-week program, depending on which facility we're in. And creative arts therapy is delivered as part of an integrative care model. The clinical program that we're partnering with the DoD and the VA includes art therapy, music therapy, dance movement therapy. These are all part of the creative arts therapies. It also involves non-clinical arts engagement that are also focused on advancing health and well-being. And in the VA, as well as in the DoD, we also provide telehealth services. And we've also been conducting a lot of research and evaluation since 2012. Our Office of Research and Evaluation has been partnering with us on those efforts. And we've been focusing from the beginning on 3 very broad sort of domains on personal impact. This includes physical, social, and emotional. In 2023, we convened a summit to investigate the research that we'd published so far. At that point, we had published about 25 clinical research papers. Now we've published more than 30 that are either published or being prepared for publication. And these are a list of some of the main themes that we have observed as recurring across these publications. They include recovering from traumatic experiences, reduction of PTSD symptoms, improvements to emotional expression and awareness, development of healthy coping mechanisms, opportunities to experience hope and gratification, and reduction of isolation and stigma. We've now been looking at developing what our strategies will be in the future. These are not indicating anything that we have conducted research on specifically yet, but on how we are going to take these themes and tighten our investigation in ways that really aligns well with DoD and VA primary aims and mission. For the DoD, this involves their concerns about improving health and building readiness. Often we hear this described as full force readiness, and it's really their interest in having an armed forces that is serving at its full capacity. For the VA, the concern is more about how people function in life, improving participation in their everyday functioning. And this is, just how they function in civilian life after they've transitioned out of active duty. So there's 4 basic focus areas that we're going to be looking at as we tighten our focus on our future research. The first is physical health. This is a capacity to perform physical tasks, how people are able to conduct themselves physically in day-to-day life. For the DoD, this has some natural alignment with how this can enhance their ability to return to duty. Their general health is improved, their ability to function better in the work that they're doing on a day-to-day basis. Some of the physical related outcomes that we're interested in looking at are improved pain, self-regulation, enhanced mobility, and increased ability to manage fatigue and improve sleep hygiene. A second area of focus that we're interested in looking at is coping and self-efficacy. This has the ability to positively adapt, especially from challenging life events. This aligns with both DoD and VA goals in terms of being able to support coping skills, reintegration, recovery, ability to snap back, mission readiness, et cetera. Some of the example outcomes in this focus area includes increased use of adaptive coping strategies, management of trauma symptoms, sleep disturbances, chronic pain, et cetera, and decreased symptoms of anxiety or depression. A third area of focus is cognitive functioning, how creative arts therapies can help to foster the ability to plan, organize, shift attention, solve problems. And this aligns with DoD VA goals to improve mental agility. For the DoD, this is for task effectiveness while on duty. And this, of course, can enhance civilian life as well for veterans. Some of the example outcomes in this area include enhanced ability to plan and prioritize, better problem solving, improve working memory, and increase cognitive flexibility and adaptability. And then the last area that we're looking at is the capacity to engage in and sustain interpersonal relationships with colleagues, family members, and friends and community members. So in other words, how creative arts therapies can help foster social health. This aligns with DoD and VA goals by improving unit cohesion, interpersonal functioning, and social integration for critical and operational success and quality of life. Example outcomes include improved communication, increased participation and capacity for collaboration, reduced isolation, and greater utilization of existing support networks. Our clinical program is currently embedding creative arts therapies in 7 DoD and 5 VA facilities across the nation, and you can see on this map where they currently exist. We also have a community engagement program, and this is something that we launched around 2016. And in the community engagement program, we're still looking at the ability for the arts to provide support for health and well-being. But in this case, we're looking at community-based programs that can be grounded in some of the things that creative arts therapies or other types of arts investigations for health have been shedding light on, but they do not involve medical treatment. They do not involve therapies of any kind, including creative arts therapies, although creative arts therapists are often involved in either designing or implementing the program. So far, we have supported 101 grant projects in 33 states, and we're about to announce another 48 grants in 24 states in July. We have not conducted the amount of research and evaluation on our engagement grants yet, although we are planning and organizing how to evaluate what the impacts are of these programs. And so far, what we are looking at in terms of what the participant outcomes are related to increasing creative expression in ways that will help you see other people more effectively and feel better understood by others, the ability to improve social connectedness, and the ability to provide resilience, which is the ability to snap back from challenging life events, and then to support independence and successful adaptation to civilian life, especially for military service members who are transitioning to post-active duty civilian life. So that concludes my overview of our Creative Forces program. I would like to thank LA Opera Connects once again for having Sunil and I join you today. I'd also like to thank all of you for joining us and for your interest in understanding how the arts can contribute to individual and community health in Los Angeles and across the country.